can do anything that we wanna do. Long as you got me, and I know I got you. We a team. No in between.
Welcome to another Wise and Wonderful Women Sit Down, and this is with Dr. Suzanne Steinbaum. She's not only a world-famous cardiologist, but she is the woman and the doctor that saved my life. What kind of a lead-in is that? Tell me a little bit about yourself.
I did one of the first preventive cardiology fellowships in this country. It was in the late 90s, early 2000s. There was one case, I talk about it all the time. It was a profound moment. She was 53, really nauseous and sweating, and you could tell she was uncomfortable. So I'm in the emergency room, and I was following the chief doctors and really taking their lead. And they gave her the diagnosis of gastroenteritis and put her in the corner, where she proceeded to have a heart attack in front of us. When I tell that story, most people go, wow, that's so awful. I'm sure that's rare.
But it's not.
But it's not.
No, it's not.
It's just been the common story.
That's right.
I think that happened 30 years ago. So it's been a 30-year career of hearing this story normalized. So after that happened, I went to the chief of cardiology. I said, I want to do a fellowship in women and heart disease. And guess what he said?
What?
There's no such thing.
There's no such thing.
Okay, if I prevent heart disease in women, then they'll never get it. I want to do a preventive cardiology fellowship. And guess what he said?
What did he say?
There's no such thing.
There's no such thing.
1 out of 3 women dies of cardiovascular disease. 1 out of 5 women dies of heart disease.
And how many women die of breast cancer?
1 out of 33.
And we're all running out and getting our little mammograms once a year.
Here's why.
Why?
We get breast cancer, we're victims. We get heart disease, we blame ourselves.
100%. I had high cholesterol. I had all the markings that I was going to have trouble. I did not want to take a statin because it made me achy, but I also came from the school of thought that if I ate right, if I exercised enough, if I meditated upside down and backwards, and I felt like a loser, like that I had done something wrong if I had to take medication, and it almost fucking killed me.
What you just said right now is what everyone needs to hear. It's not your fault. You shouldn't feel guilty. And if we can change that narrative, we are going to change the statistics.
Right. Why didn't all of these things exist, like preventative heart care or research? When was research done?
So it wasn't until 1984. More women started dying of heart disease than men. They thought all this time it's a man's disease. And all of a sudden, we start seeing women die more. Why? That 20 years prior, all the research were done on men's hearts, and it was extrapolated to women. But it
Guess what? Men and women are different.
Wow. So I was going to say, it took till 1993. The Office of Women's Health opens up, and now NIH grants are saying women have to be included in the study. I was in medical school, and I was told women don't get heart disease. That is not the teacher's fault. That is the textbook. That is the research.
But wouldn't it be common sense?
It was because women have estrogen, and so they were protected, and men got heart disease because they didn't have estrogen. You know, it was rooted in this false science.
But so what would happen if a woman dropped dead of a heart attack in the hospital?
That's what I was seeing. These women would be brought in, and they had heart issues. They weren't sent for testing. They were oftentimes misdiagnosed and then sent home. Out of the women who were sent home, how many of them dropped dead of a heart attack?
Right.
We don't know. Here's the piece that gets infuriating and fascinating. Let's say they were sent for an angiogram, an invasive test that is done in the artery. Dye is injected, and that dye goes into the arteries, and it takes a picture. If there was an artery that had a blockage, the dye wouldn't fill in there. 66% of the time, when a woman comes into the emergency room and she has symptoms of chest pain and she's sent for an angiogram, 66% of the time, it's normal. Why? Women's hearts are different. Men get disease in one location. You do that angiogram, you see that blockage, you put in a stent, it opens up, he's fine. With women, the disease is diffuse. It's soft plaque that goes throughout the artery. So when you inject the dye, it all looks normal. The women in heart disease story needs to be exploded and rebuilt.
So that men are tested as men and women are tested as women.
Wow. And that goes back to...
So insane.
How medicine is treated and how we look to decide how to give medication or who to aggressively test more or what to do is based on a risk analysis.
So if you don't think that women are at risk for having heart disease, then you're not going to be testing women for heart disease. This is a case in point. A friend of mine who is a former heavy smoker, overweight, never exercised a day in her life.
Yeah.
Friend of hers is at the office and says, I just got a calcium score. And she says, you know what, I should probably get one of those. My father died of a heart attack. So she goes to her cardiologist. She's 68 years old. I don't believe in those tests, he says to her. And she said, well, you know what, I'd like it anyway. And he said, well, you'll have to pay for it out of pocket. So she says, okay. Well, she's now the proud owner of 3 stents. I mean, talk about being dismissed. And this is coming with some information, advocating, having the wherewithal and the financial wherewithal to push for it.
We have a 68-year-old woman with a strong family history who's a smoker. By definition, that puts her at least at moderate to high risk.
Right.
If you put her through the analysis, she would come out low risk.
Who's doing this analysis?
It's the
Okay.
American College of Cardiology. It's the American Heart Association.
And why would that be?
Clinical research takes decades, but it takes about 15 to 20 years for research to hit clinical practice and then to change guidelines. It's a lot of
Right.
clinical research.
Going into my heart attack, I had a calcium score, which basically said that I
You had
had no
nothing.
plaque.
Yeah.
So I was saying, well, if I, again, just do everything possible to will this cholesterol away, why would I have to take a statin? Because I don't have any plaque. And even though I was told by my cardiologist, which was you, to do it. There's a new test. Tell us a little bit about that.
There's something called the MESA risk analysis that showed that if you take the standard risk analysis and add calcium scoring to it, it actually might pick up disease in women who were otherwise thought as low risk. The calcium score was found to be an additive risk factor. If women have calcium, that's when we need to start statin. Women do not get hardened calcified plaque till about 10 years after men. Disease begins with soft plaque. More heart attacks happen when plaque is soft at 30 to 50%.
That's right.
Not calcified at 70%. Stents go in at 70%. Clearly utilizes AI technology and quantifies not only if it's calcified or non-calcified, but it tells you the total plaque volume. If she has a lot of soft plaque, believe it or not, her risk of heart disease is higher than it is for a man. So now we have this new test that can re-risk stratify women, can really provide information. What do? We gotta teach the patients. We've gotta teach the doctors. And we're in a place where education is not just through the journals. It's not in those commercials you see for every vitamin pill. What we have now is social media. We have
Right.
a platform that we get to
Right.
say, hey, there's this thing. Let's talk about it.
Women have different symptoms of a heart attack or a stroke that are not the typical. Someone's having a heart attack. It's like,
Elephant sitting on the chest.
exactly.
Sweating.
Oh, sweating. Like an overweight, chain-smoking man walks into the ER. He's having a heart attack. That the doctors seem to understand. A woman comes in and says, I have jaw pain, or I'm exhausted. I have shooting pain in my chest or my back. I am nauseous. Now, some of these are symptoms that you would have of the flu.
Yeah.
But you know when something's not right and you need to trust your gut.
So here's what I tell every woman. If you have a heart, you're at risk for heart disease. The more you know about your own personal health and your risk factors and your family history, the better off you are.
Right.
If you are not feeling yourself and you go to the hospital, don't wear lipstick, look as horrible as you possibly can, and you say, here are my symptoms, I think I'm having a heart attack. If you don't take me right away and I'm having a heart attack, I'm calling my lawyer, because that's going to bring you into the room quicker.
Right.
And that's what you need to do, because that's where we are right now.
This is not a matter of like trying to get to the front of the line. This is about being taken seriously, because women have a tendency to say, I'm sorry, not want to bother anybody. Women are told that they're crazy.
Well, that's the
what
problem.
I was told.
Yeah.
You're having an anxiety attack. You're stressed out. They would never say that to a man.
No.
What are the 5 or 6 things that a person can be doing to lower their risk of heart disease?
I'm going to change this narrative.
Okay.
First, bullet point is risk factors. And that includes your blood pressure, your cholesterol, your sugars. I want you to know your waist circumference.
Okay.
Greater than 35 inches increases your risk of cardiovascular disease.
Okay.
I want you to be very conscious of your lifestyle choices, which includes not smoking, vaping, inhaling anything. Second bullet point is how are you going to eat? When you're at risk for cardiovascular disease, many people genetically cannot metabolize fats. Eating meat every day is not going to be the diet that you want to eat to prevent cardiovascular disease.
Yes, one would say that that's common sense. Yes.
The best diet for you is a Mediterranean diet, high in good fats, omega-3 fatty acids, multigrains, vegetables, fruits, olive oil, avocado, all of that stuff, nuts. Like, this is the diet.
Right.
Exercise. I think there's a whole cohort of women. We didn't think we were exercising unless we felt like vomiting.
Right.
That is not what we need.
Right.
It's not good for your heart. Exercise is medication. Period. End of story. Put it on your calendar. And I don't
Every
want
day.
anyone to tell me
Every day.
they don't have time to exercise.
Every day.
Cardio, and then we have weight training. Weight training are major muscle groups
Okay.
2 times a week.
Got it.
Now we talk about sleep, 7.5 hours a night. Put yourself to bed the same way you put your baby to bed. Do it the same time every night. Have a cup of tea, whatever it takes, light a candle, put yourself to bed, no TV or phones in your bedroom, end of story. Stress is a deal. Everyone needs some kind of tool for stress management. The one that I always recommend, just because there's so much research on it, is TM.
TM, yep.
It's 20 minutes twice a day. It is literally going to sustain your nervous system
Yep.
throughout the day and
Yep.
level things out.
Yep.
But the other thing that I think is critically important for everyone to do is know these critical numbers of blood pressure, cholesterol, and sugars. You also need to understand your genetic factors. All of these are a simple blood test. And when you take all these different factors and put it together, and then you get tested, something like a Clearly, you will know how to be treated to prevent heart disease.
Yes, you are assuming that your doctor is running these tests. You are assuming that when you get these test results that they're actually going to be discussing them with you and coming up with a plan. And that's why I love you, because I feel like you are a detective.
As you know, this has been my mission, my passion, my purpose.
Exactly.
I just built a technology company. It's not yet available, and I want everyone to look out for it, because it's going to take all that information that we just talked about and create something for you to bring to your doctor to say, this is what I need and why.
Right.
And you will have the script. In the meantime, if your doctor won't do it, find a doctor that will. There is data, there is research. Find the research.
Right.
You have to be your own best self-advocate and look for it.
Doctors are not gods. People look at them like they know all. They can't possibly make a mistake. And it's just not the case. The crazy comments that I am hearing and stories, the more that I get involved with the American Heart Association and kind of sharing my story is horrifying to me. And I just feel like I want to be a warrior for women. And I know that you have been for years. And I want to thank you not only personally, but for all of us.
People said to me, why did you do this? When you see something that is so despicable, how do you not? Because I didn't feel like I had a choice. My involvement with Go Red for Women, writing books, doing television, launching a technology company, we've got to change the statistics. I've been doing this for 30 years. They have not changed. It's the time.
Thank you for being here.
You're the best.
No, you're